Hi, my name is Wendy. I'm a student nurse and I'm going to be showing you how to do a newborn assessment today. First of all, right after the baby is born, at 1 minute and 5 minutes, you're going to be getting an APGAR score on the infant. APGAR stands for appearance, pulse, grimace, activity, and respirations. You're going to score each one of those a 0, 1, or 2 with a total possible score of 10. You're shooting for 7 to 10. 0 to 3 is going to require immediate resuscitation on the infant. 4 to 6 requires some stimulation or oxygen support. 7 to 10 is what you're shooting for. You're going to do it every 5 minutes until you reach 7. There's also something called the Ballard score. It assesses the physical and neuromuscular characteristics to estimate gestational age. It guides your expectations for growth and stability, but it is only done on preterm, post-term, or mothers who receive no prenatal care. You always want to try to maintain temperature on the infant. They lose heat in 4 different ways. The first one is conduction, which is heat loss by direct contact with a cold surface. So you always want to make sure there's a blanket or something down on any surface that you set the infant down on. Convection, which is heat loss due to cool surrounding air. There's also evaporation, which is when moisture on the baby's skin turns to vapor. That is when the baby's born, there's a lot of moisture on the skin. You want to be sure and dry them off completely. There's also radiation, which is heat loss to nearby cooler air without contact. You always want to keep something on your baby's head because it loses the majority of the heat from its head. Now, you are going to check vital signs, but not always during the assessment. It's usually just done before the infant leaves the hospital, unless there are issues. You want to make sure they are within normal ranges. Normal blood pressure is going to be 60 to 80 over 40 to 50, and it's taken on the lower leg. Your normal respirations are going to be 30 to 60. Your normal heart rate is going to be 110 to 160, and your normal temperature is going to be 97.7 to 99.5. And you're going to take that rectally. It will give you the core temperature of the infant, and it will also check the patency of the anus. You're going to note acrocyanosis, which is blueness of the hands and feet right after the baby is born. It's just where the circulation hasn't quite caught up yet. But that is perfectly normal as long as you don't see it anywhere else like the mouth, the tongue, or anywhere like that. It should return to normal after 24 hours. So then you're going to want to assess the head and neuro. So you're going to look at the baby's head. You're looking for, there's 2 fontanelles. One is the anterior fontanelle, which is towards the front. That one is diamond shaped, and it's going to close between 12 and 18 months. The posterior fontanelle is triangular shaped, and it's going to close between 2 to 3 months. A sunken fontanelle, you're going to gently move your fingers over the fontanelles. A sunken fontanelle can let you know there's some dehydration. If there's a bulging fontanelle, it could let you know there could be some intracranial pressure. You're also going to, the suture lines, there's going to be some molding where it went through the vaginal birth. They overlap in order to collapse just a little bit to fit through the birth canal. Then you might see some caput succedaneum, which is just the normal swelling from going through the birth canal. Or there's a cephalohematoma, which that one is going to cross the suture lines, and it's due to edema. Or that's the caput, sorry. The caput crosses the suture lines and is due to edema. The cephalohematoma does not cross the suture lines. It's caused by bleeding under the periosteum. You're going to observe for milia on the nose. They're like white sebaceous cysts. They are of no concern and they will go away. You're going to look at the face for symmetry, make sure everything's even. You're going to check the pupils of the infant on each side. Make sure they're both reactive. Make sure the eyes are the same size. There's no drainage. Make sure they're symmetrical. You're also going to check the ears for drainage and symmetry. Make sure there's no folding or they are not attached at the back. You're going to look in the infant's mouth. Make sure it's pink. And you might see some Epstein pearls on the gums. They're just soft, benign findings on the soft palate. You're going to take a gloved hand and put it in the infant's mouth. And it should immediately start suckling, and that checks your suckling reflex. If you push back just a little bit further, that will check the gag reflex. The infant should gag. You're going to make sure the nostrils are both open, patent. And you can also check the suckling reflex. You just touch the side of the cheek and the infant should turn towards the cheek that you touch. You just want to make sure everything is symmetrical. You can also check make sure the neck is tonic. If you turn it to one side, the arm on the side that you turn it towards and the leg are going to fan out that way, and kind of like a fencing move. That's going to check the neck tonic reflex. Then you're going to go okay, you're going to check you can check the other reflexes. You're going to lift the baby's hands up. You should be able to put your thumb in the middle of the baby's palm, and it's going to be the palmar grasp. They should wrap their fingers around your thumb. You can also do the same thing on the feet. That's the plantar reflex. You also want to lift one of the feet and take your finger and go from the heel to right below the toes, and they should fan out. It's called the Babinski reflex. And then you also want to check the Moro reflex. If you carefully pick up the infant and just kind of drop its head just a little bit, the hands and feet should jump up and then retract back towards the body. That is all perfectly normal. Now I'm going to observe the chest for symmetry, the breathing pattern and effort. Babies are belly breathers, so you're going to notice how they're breathing. Make sure it is, you're looking for respiratory distress. You're going to look for nasal flaring, grunting, retractions, any other cyanosis besides the acrocyanosis. When they're born, the lungs produce surfactant. And it's important because it reduces the surface tension of the lungs and keeps the alveoli from collapsing, which is where gas exchange takes place. You're going to take your stethoscope and you're going to put that on and use the small part, and you're going to also take the sounds of the lung. You're going to do that on the front here, just checking for breath sounds and making sure you don't hear any abnormalities. You might hear a little bit of wet sounds, but that's from where they were breathing amniotic fluid. That is okay. You're also going to take the heart sounds in the 4 spots. You're going to listen for any murmurs, any irregularity, anything like that. You will note what's called a harlequin sign when the baby cries. You'll notice one side will turn like bright red and the other side will be pale. That's normal. It's immature circulation and you don't really have to worry about that. It should return to normal. You also want to remember that while the infant is in utero, the circulation is backwards than it is in the mom or any other adult. There are 3 shunts that are in an infant's heart, and it's the ductus venosus, the ductus arteriosus, and the foramen ovale, which circulate blood in utero and move oxygen from the mother to the infant. After birth, the pressure and oxygen changes, causing them to close so the newborn can oxygenate through their own lungs. You may also notice some breast engorgement. That is normal in males and females. It's just from where the baby was getting maternal hormones, and that will go away. You're gonna move down to the abdomen. You are going to listen to bowel sounds in all 4 quadrants. You just listen across all 4 quadrants, and you're going to palpate lightly for masses, tenderness, or any organ enlargement, anything that just doesn't feel right. You're going to look at the umbilical cord. You're going to see if there's any redness, any drainage. You're going to inspect the umbilical cord itself. You're looking for 3 vessels, 2 arteries, and 1 vein. The vein carries oxygenated blood from the placenta, and the 2 arteries will carry the blood back through the umbilical cord. You'll notice some Wharton's jelly around that. It just protects the vessels from compression. You're also going to make sure you are looking at skin all over the infant. You are going to flip the infant over. You're going to check the spinal cord from the neck all the way down. You're just going to notice if the spinal cord is straight. You're going to notice if there's any dimples or hair at the sacrum, because it could be indicative of spina bifida. You're going to be looking at all the skin for any type of birthmarks. You'll have stork bites, which is light pink patches, and they're usually on the eyelids or the neck. Strawberry hemangiomas, which are raised bright red areas. It's just dilated blood vessels. Port wine stains, flat dark red birthmark that does not blanch, and a lot of times it's on the face. You're going to look towards the sacrum and the top of the buttocks, where you might find some Mongolian spots. They're bluish patches, commonly on the back or buttocks. It's more common in darker skinned infants, but you really do need to document these and make sure you are accurate in your documentation, because you don't want them to be confused with bruising at a later doctor appointment. You're also going to notice sometimes vernix, which is a white creamy substance that protects the skin. A lot of times you might find it like under the arms or in the groin area. You might also notice some lanugo, especially in preterm infants. It's fine hair that covers the shoulders and the back of the infant. You're going to inspect the extremities for movement, symmetry, any abnormalities of the fingers and toes. You're going to want to notice the fingers and toes, they all separate, and they don't have any syndactyly, which is where there's a webbing in between the fingers or toes. And you're also going to look to see that there are 10 of each. If there are more, it's polydactyl, and you're going to want to document that. You're going to look at the palms of the hand and look for a straight line across. It's called a semen crease. That could let you know that there's some kind of defects there. And then you're going to check all the peripheral pulses. You're going to check the brachial pulses on both sides, making sure they're symmetrical and they're the same strength. You're going to do that with the brachial, the radial, and the femoral arteries. Other than that, you're always going to make sure your baby is warm and covered. And then I'm going to wash my hands and give the baby back to mom. That's it.